Sorry, thank you again for highlighting that I have no sound. Thank you for, I've switched off my volume again. So, again, as I said, this is the continuation of navigating the COVID storm. So, recently I had shown or had discussed the pathology around the COVID storm, spike triggered autoimmune response mechanism. And this here is what I think is happening now. And this is based on clinical observation, the research. And I think that this is a very serious aspect as to where the pandemic is. The problem with this COVID storm is that it's not so obvious, meaning that it's not like in the first part of the pandemic where people just suddenly got sick and you could see them on intensive care. And as a result, it's not being taken as seriously. The problem is that when people get sick in the context of this COVID storm, sometimes it takes weeks or months before it causes morbidity or mortality. And so we really need to be thinking differently in order to try and make sense of what is going on. I'm going to start the presentation, and if you're on YouTube, you'll see the first part, and then it will only be for people who had registered for the webinar. Before we start, just a quick reminder that I want you to ensure one, you click on the subscribe button and click on the notifications button as well, and critically look in the description. It will be there afterwards. It's not there yet for the link to join our newsletter. And so that link will be there quite shortly, right after I've finished the presentation. And additionally, if you want to do the COVID 360, this is the most complete course you will find anywhere in the world. It is now going to be over maybe almost 60 modules of information going through every aspect of COVID 19 as I've been searching over the past 4 years of research. So the reason I put it together is simply because I recognized that I had to collate all this information that was in my head and put it in a consistent and coherent fashion for people to learn from. So it's a very valuable bit of information. So if you're interested in this, it gives you, in my mind, almost every answer you should want to know about the pandemic. And so let's get straight into the presentation with regards to navigating the COVID storm. So now we are at a stage of our learning where we are looking not just at the pathology, but we're trying to understand how we can utilize our understanding of the pathology to predict where things are going to occur and critically how we can intervene in that whole process. This is essentially what I'll be trying to do today, navigating this COVID storm. And remember, the storm is spike triggered autoimmune response mechanism. It's important to note that although I have focused on the spike triggered, the acronym is primarily there to make sure that you understand that it can be virus or any other source of spike protein that can trigger this process. It's difficult to know who is affected because very often the symptoms are extremely subtle and therefore it can easily be missed. It's different from what happened early in the pandemic, where people got very short of breath, needed oxygen, and almost invariably had to be in hospital. Again, our disclaimer, it's important to note that this information is there for the purpose of education, information. It cannot substitute for you getting professional medical advice, because there are many things that we would talk about here generally that may not be appropriate for someone who is on medication or has interactions or other problems that we may not be aware of. You can take this information and you can discuss it with your clinician. Very important point. I'll be aiming in this section to go through a few specific things: understanding what storm is, why it should not be ignored. We should be looking at identifying various therapies for storm and how they might work. and looking at the significance of intestinal protection and recognizing natural products that are potential therapeutic options. That's really what has driven me to focus on this, because people kept on asking me, well, even if we understand it, what do we do about it? So I really had to spend quite a bit of time reflecting on what is the pathology. If I understand the pathology, how can we use simple strategies to be able to interact with it and interfere with the process? So, targeting macrophage activation holds therapeutic potential for treating inflammatory and autoimmune diseases. I mention macrophages because they are such an important part of what it is that I am describing in the context of this COVID storm. But again, I'm taking you back historically to understand the full spectrum of COVID 19. You had a big percentage of people who barely had any symptoms. They barely knew that they had COVID. And in this cohort of people, largely they had very good mucosal immunity. And they probably weren't as susceptible to the interferon response, so they didn't feel sick. Then you had another cohort of people who had COVID bronchitis. They had the infection, and this was especially true with Omicron, which would infect the upper airways, trachea, and bronchi, and they'd end up with this almost 100-day cough that just didn't seem to go away. The COVID viral pneumonia is where there is inflammation in the lungs. People may feel a bit sick, they'd have a cough, and if you looked at a scan, you would see inflammation. This would only cause somebody to get in hospital if they had underlying lung disease. So if somebody had COPD, or even if they had lost a lung, or they had some other kind of lung disease and they got the viral pneumonia on top of it, that could get them into hospital and could be significant. However, when we come to moderate and severe COVID 19, the critical difference is to do with microclots, little clots in the blood vessels in the lungs. In moderate COVID 19, I predict that maybe about 80% of the alveoli are blocked up. By the time you have severe COVID 19 in a healthy person with normal lungs, for them to die on a ventilator, you would literally have to be blocking maybe 90% of the alveoli in order for them not to be able to make it through. So the combination of the viral pneumonia and the microclots is what, in my research, differentiates severe and moderate COVID from, say, just the viral pneumonia or the COVID bronchitis. Microclots are extremely unusual in most viral infections. And in my view, again, our research points to this being a lung vasculitis, damaging the lining of the blood vessels, which then causes the microclots. This is why we've always said this fits with an autoimmune disease. And again, then beyond the COVID, that's people who've had severe disease, there is then a number of manifestations that go beyond the disease. Autoimmunity is what we've always said was central, and this is what is being shown with autoantibodies to ACE2, just as we predicted in 2020. But along with that is this issue about immune failure, the lymphopenia, and the dysregulation of the immune system. On top of it, because of chronic circulating infection, you have interferon suppression, because this is the primary modus operandi of this virus. It suppresses interferon almost better than any other virus. And then when you add into the mix what happens in terms of the gut microbiome and the fact that the bacteria, especially Clostridium difficile, seems to be producing more toxins and wiping out good bacteria, this is one heck of a combination of things, and which is why many people are sick. And you can see the overlapping things, and the most sick people will be right in the middle here. Many people will have different aspects of this who are feeling a bit unwell, and this is where it has a longer term impact on general health of the population. The rule on principle is still keep the virus out of the bloodstream. That's how I describe it. And I usually use this to show the virus infecting the upper airways. It can get infection here, and it can resolve quite quickly with good mucosal immunity. Remember, there are many people who are exposed all the time and don't get any significant infection. And it's because this lining here prevents any further spread of the virus. So it's like a barrier. IgA antibodies, the immune cells, all functioning together. And the principle is that you want to prevent the virus from getting into the systemic immune system where it makes systemic antibodies. Because if there is autoimmunity, the antibodies will then trigger immune mechanisms within the body outside of the upper airways. So that's the critical bit that we're trying to see if we can achieve. How do we, in an environment where there is high circulation of virus, prevent it as minimally as possible breaking through that mucosal barrier? And remember, the mucosal barrier is not just physical. And this is the physical bit. These are the cells. There's mucus on top. The virus has to get through that with the antibodies. Even when it infects the cell and it tries to get beyond the mucosal layer, there is a line of an immune defense that will normally protect from the virus coming through. An important point as to why, in my opinion, we're having ongoing circulation of virus in highly vaccinated regions is that this immune defense is so focused on the original variant, the Wuhan variant. So all the other variants coming afterwards, it's still looking for the original variant. In my view, that's similar to what can happen with dengue, with the different viral variants that happen there, and the immune system can become hyper focused. That, in my view, is the reason why the immune system is not as effective in highly vaccinated regions and we have ongoing circulation of virus. I know many people disagree with that, but I cannot find any more logical explanation as to why this is the situation, because it doesn't seem to be happening globally, only primarily in highly vaccinated regions. Once you have the virus breaking through, one of the points we were making in terms of the pathology is you then have viral sepsis. Viral particles circulating in the bloodstream, infecting endothelial cells, circulating again, and based on what we seem to be seeing, this is exacerbated because of IgG4. I'm not covering it today, that's in the course, where it's the immune tolerant antibody that makes the immune system not target these viral particles as effectively as they should. This is therefore part of the reason why I anticipate the storm, because you are having spike proteins circulating quite frequently and triggering immune pathology. When you have COVID infections, and we noticed this happening early, but it took a while to figure out what was going on, there are specific lymphocytes. These are specific types of white blood cells that are affected after infection. CD8 T cells are reduced. CD4 helper T cells are reduced. B cells that produce antibodies are reduced. And one of the critical ones is the natural killer cells are also reduced as well. So when people talk about COVID behaving like HIV, it's not accurate in the pure sense of the word, but in terms of damaging the immune system and the lymphocyte function, that is probably a relatively close approximation to what is going on. So these are actually very, very important stuff that we have to deal with. Now we come to that point about the storm. And remember now, this is where I'm taking you through the basics of the science to remind you as to why I'm talking about this spike triggered autoimmune response mechanism. Here is where I'll come to the fundamentals of the pathology as I have seen it. What we have in the center here is an activated macrophage. And remember, macrophages are just one aspect of the immune system. I call them the tanks. The big cells, they eat up lots of dead bacteria or live bacteria, viruses. They do a lot of eating, and they're also antigen presenting cells. So they're very versatile immune cells. But normally, these macrophages can become overactivated, and everything about the body is balanced. And so the body has about 4 different ways of controlling these macrophages so that they don't become too activated and damage normal tissue. So you have M2 macrophages, myeloid derived suppressor cells, B regulatory cells, and critically the NK or natural killer cells. These all work together to try and keep these macrophages in check. And this is now where we have the very unusual pattern with regards to COVID and what happens beyond COVID. This piece of information was covered in more detail in the early part of the storm presentation. So you'd have to look at the full presentation to see that. But the really important point that I've been looking at now for probably almost 3 years is this very unusual pattern with regards to ferritin. Now, ferritin is just really a storage form of iron, and it's located in particular areas of the body, liver, usually the upper small intestine, and critically, macrophages or monocytes. I've done this diagram to show you what the ferritin looks like. It's stuck inside here, and then when the body needs it, it can release it. And it's usually also released in the context of infection. So an infection can cause the release of ferritin, and so it's what we call an acute phase reactant. However, what I've been seeing and what I think people need to look for is the fact that many people have a significantly elevated ferritin way above what we would expect, even when there is no obvious inflammation. As far as I can see, pathologically, that suggests that macrophages are activated. And genuinely, I would say, I think it is such an important test. Its problem is that it is non-specific. But if you see changes in ferritin, it can be valuable to know. And so one of the simple tests that I think many people who are not feeling well should do is make sure you have a baseline ferritin. Compare it with your iron levels, because if your iron levels are low, and you don't have any specific inflammatory process, your ferritin levels should be very low as well. We normally use it to find iron deficiency anemia. And so it's a very important blood test. And that's a really critical secret that I hope people will be able to use. So this is what happens based on the prediction with regards to storm. Remember, I am going ahead of the science here to predict what is happening. Spike triggered autoimmune response mechanism, storm. What I have predicted pathologically is that what we have here is that these activated macrophages that are being trying to be controlled by the M2 macrophage and these myeloid derived suppressor cells, because of the associated lymphopenia, taking out these natural killer cells and the regulatory cells, suddenly it is much more difficult to control this inflammatory process. And this is what I think is driving the ferritin and the associated diseases that will come in the medium to longer term with ongoing activated macrophages. So, this is why targeting that macrophage activation, in my view, holds therapeutic potential for treating inflammatory and autoimmune diseases around COVID 19. Good. That's the first part. And for people who are on the webinar, save your questions because I'm going to go straight into what I am giving away to the YouTube audience. A really important secret, in my view, as to how to manage the storm, because people keep asking, what can I do? And what you will find is a link as well to my own take on this approach that even I use in my day-to-day normal practice to manage or navigate the storm that I'm continuously around because of ongoing infections. Omega 3 balance is probably one of the simplest and most significant strategies that anybody and everybody should be using in the context of generally life, but especially what is happening in the context of the pandemic. See, omega 3 is essential and it should always be in balance. And this is one of the mistakes people make. They think it's just omega 3. No, it's the balance between the three the 6 and the 9 that is really important, because everything in the body is about balance. Too much of anything causes issues. But here are the basics, because most people are deficient in omega 3s. And there's a reason why. Is that omega 3s, they are essential fats in your body. Your body can't produce it. And when you think about it, if you go back into the old days, the thing that people used to eat almost every day was fish. And so over time, genetically, the body realized, well, it didn't need to produce omega 3s because everybody's eating fish all the time. What then happened is, as that we have industrialization, shift in the way how people live their lives, suddenly we're not eating as much fish, and therefore the access to omega 3s the body no longer has, because it literally switched off the ability to make it. Other animals make omega 3s, but not humans. So we have to get it from our diet, and this is just a picture of some of them. It is absolutely crucial to maintain overall health, and it has a significant role in brain function and heart health, and it reduces inflammation. This is now where it comes into that relevant point about why I'm focused on it and why I'm dealing with it up front as a critical part of managing this COVID storm. There are three types of omega 3 fatty acids. There's alpha linoleic acid, ALA, usually from flaxseed, soybean, canola oil. There's docosahexaenoic acid, DHA, salmon, mackerel, and sardines, as well as EPA. This is the fish oils that we will get. And all three of them together are combined to be the omega 3 fatty acids. Now, what you have to remember, as I said, is you have to get it in your diet in one way, shape, or form. And this is how it's relevant in the context of the COVID storm. What I've got here is that for many people, if they're not eating enough fish, they often have to supplement with this through capsular form. The omega 3 fatty acids, one of the things that will happen is that they will be picked up by macrophages. Not just macrophages, but I'm focused on macrophages, but also neutrophils and dendritic cells. And then they make these very interesting mediators, resolvins, protectins, merisins. And these then have an impact on other cells to suppress inflammation. And it's all part of the balance that the body needs in order to keep things on target. And this is why I said, so omega 3s are not just about brain health, because interestingly, it's a critical part of myelin. And so almost 70% of the omega 3s that you have are concentrated in the nervous system. And so if you want to have good brain health, you have to have it. Again, it's not in your diet. I mean, it's not in, you can't make it from anything else except your diet. So it's very, very important. And even more so in the context of the storm, because of the inflammatory process that I predict is happening with macrophages. The other part is to do with viral sepsis. And I think this is especially important in those people who can't control the infection effectively. They are getting reinfected all the time. As I said, in highly vaccinated regions, this is more likely to be people who have had their immune system too focused on the original variant, and they're getting breakthrough infections. You just have to imagine the virus circulating. There's IgG4, so it's not causing any significant illness. So there is an infection of endothelial cells and so on. But here is the bit that is really important with regards to circulating spike. And this is to do with netosis and microclots. So what happens is that the viral particles can get trapped by neutrophils, and just circulating spike protein can trigger it as well. And so these neutrophils go and make these nets where they trap the virus or spike protein, and then they trap platelets with them, and then it can then lead to little microvesicles being formed because of the tissue factor in the region. Then you have blood getting caught up in it, and then you end up with this little thrombus called a microclot. And this is occurring so significantly. And one of my speakers was saying that they are seeing it across the board in many people. When they look under their dark field microscope, microclots are everywhere, grade 1 to grade 4. And in my view, one of the ways to minimize these microclots is through omega 3s. You have to remember, omega 3s also have the effect of thinning the blood, so much so that we have to be careful about using it if somebody's already on a blood thinner like warfarin. And so it has that natural impact of thinning the blood. This is why I have focused on it. And you will see a link in the description that will take you to where I give you some more information about my thoughts on it. And if you want to know what I use in terms of premium quality, I am happy to share that with you as well. So you'd have to look at the link in order to understand that. But omega 3s, simple, important, effective, and essential to keep your body and health in balance. Right. So thank you to my YouTube audience. I will have to let you go now. And I look forward to sharing more information with you in the future. For my webinar attendees, please stay with me until after this outro.